This taping here is for knee hyperextension or to protect the ACL or the PCL, which are main structures will get damaged with a hyperextension. So either someone's had an injury where they've hyperextended their knee, or they feel pain when they straighten their knee. They're saying it hurts when I straighten my knee. Again, there's a few different ways we can do this. We could get the fixing tape and we could put an anchor, and then do rigid, and then create a cross across the back of the knee. More efficiently, and a way that they can tape themselves as well, and probably just an easier way of taping, is to use the elastic adhesive bandage and then reinforce it with some rigid. But you absolutely could do the rigid underneath and then just wrap it up with this. So if you just take your legs a little bit wider apart, Belle, and just bend this knee slightly. Are you okay in that position?
Yeah.
So what we're trying to do here is we're going to create a cross over the back of the knee, and then I'm going to reinforce that with some rigid tape. So when you're going around the thigh, you don't want too much tension on that part. Then we're going to come down. We're going to cross the knee. We're going to go around. And we're going to cross the back of the knee. When you guys practice, I might show you a slightly different way as well, but that's our kind of starting point. And then just to reinforce that tape, thanks, Belle, you can then do 1 or 2 extra layers with the rigid tape. So just bend your knee slightly for me, Belle. Again, you judge off how painful or how lax or how much restriction the player needs or wants. And then I would just finish by wrapping one full round. So the good thing with the elastic adhesive bandage is it makes your tape job look really neat, and it covers over everything else. So if you had a bit of rigid tape underneath and then you finished with that, if you've used that, just trim it and then just lock it off with a little bit of rigid. So Belle, now if you try and straighten your knee, you should feel like that's pretty restricted. It doesn't let you straighten it back.
Yeah.
If some people are quite hyperextensive, again, you might not want to do it too restricted. If they need more restriction, you could keep them in more bend initially. So that looks pretty neat there. If you want to step down, Belle.